Hi everyone, how are you all doing? So officially second year has started and there is a lot of noise from all the directions. Read this book, this note, that note. So I am here to give you one gospel of basic books that you must read, which everyone reads in order to do MBBS in our country. So obviously in second year, the three main subjects that you're going to have is pathology, pharmacology and microbiology. You may or may not have forensic and PSM along with it. Forensic, as far as I know, it has been moved to third year of MBBS, and PSM is of course Park and nothing else. For pathology, you have to read Robbins, okay? Even though some people prefer reading Harsh Mohan, but reading Robbins is going to take you a long way because that is going to help you while understanding surgery and final year subjects as well. So do try to bite the mid-range for Robbins. Of course, the biggest Robbins you cannot read, and the baby Robbins does not have much information. So the mid-range Robbins is a good big book. Of course, then there is Harsh Mohan also. Having said that, simply Robbins and PW notes, this is enough for you to pass pathology, and especially with the skills video, it becomes even easier to correlate your Robbins knowledge with the practical specimen knowledge that we have provided in skills video, and also whichever little small practical guide which is in circulation in your colleges, please go ahead with that because that defines more of the specimens which is available in your colleges. Coming on to pharmacology, there is just KDT. KD Tripathi is a very good book. It is enough to read any pharmacology that you might want to read. Coming on to my subject and the one I have the most knowledge about, it is microbiology. And for microbiology, Apurba Shastri is not a standard book, which might be an unpopular opinion, but it is definitely an easier book and students like to prefer reading it. But whenever you're reading Apurba Shastri, always make sure that you're correlating many facts with the standard books such as Ananthanarayan. Ananthanarayan Panikkar is considered a standard book. So I would suggest that watching our lectures, reading our notes and then reading Ananthanarayan is what is going to give you a wholesome, correct knowledge base, and it is really going to help you if you prefer Ananthanarayan. The problem is that parasitology is not much covered. So the age-old book is Chatterjee. There is also Dr. Arora's book. Some students also like Apurba Shastri's parasitology, but it has a lot of information. I personally like it better than many other parasitology books because it is easier to understand and very point-wise it has been given. But I believe the best way to read parasitology is to download the DPDX life cycles from the CDC website and incorporate everything about that parasite, annotate within that life cycle itself, right? Then having the Bible of microbiology is actually Topley. Nobody ever is been able to read Topley, so do not even think about going there. For parasitology is Lynn Garcia, again not needed at your level. What you need is either Ananthanarayan and Panikkar or Apurba Shastri, whichever you prefer, you can read at MBBS level. Then for parasitology, you may refer to Chatterjee, Arora or Apurba Shastri again. For virology, there is a beautiful book by an Indian author called Medical Virology by Baijanti Mala Mishra. That is a very good book, but it has a lot of knowledge. This is almost PG level knowledge. So I think one basic standard book, Ananthanarayan or Shastri, is going to suffice you. If you want to read international authors, then Javits, Lippincott and Levinson are some good books which you can read. Benefit of Shastri is that there is immunology also, but if you want to read immunology separately, you can always refer to QB's immunology if you have a lot of interest in immunology. I think that was all the important books that you needed to read for Path, Pharma and Micro. If I missed any books, please mention in the comments and let everyone know what you are reading in your colleges.